Welcome to the first edition of Pulse TV, a production of Greater Lawrence Family Health Center. I'm your host, Mark LeMay. In this edition, we're going to introduce you to the Health Center with the help of Dr. Joseph Gravel, GLFHC's Chief Medical Officer, as well as the Director of the Lawrence Family Medicine Residency Program based at GLFHC. We're going to cover a wide range of topics in this episode, including talking about the services GLFHC offers, healthcare reform and what it means to you, the healthcare consumer, and the future of medicine from Dr. Gravel's perspective. So without further ado, I'd like to introduce Dr. Joseph Gravel. Before coming to GLFHC, Dr. Gravel served as Residency Program Director of the Tufts University Family Medicine Residency for 14 years, and also served as the Medical Director of the Sherwood Project, a free clinic in Malden, Massachusetts. Dr. Gravel has significant national, regional, and statewide leadership experience in family medicine. He also serves as the President of the Association of Family Medicine Residency Directors after serving 5 years on its Board of Directors. We're proud to have him at GLFHC and proud to have you on the program. Dr. Gravel, welcome.
Thanks, Mark.
Let's talk a little bit about what GLFHC is and what we're all about.
Sure. So the Greater Lawrence Family Health Center is a community health center. It's a fairly qualified community health center, one of 52 in the Commonwealth of Massachusetts. What GLFHC is about is serving the community of the Merrimack Valley, the Lawrence community and surrounding communities. The reason for the health center's existence really is to provide comprehensive primary care to those communities, to provide preventive medicine services to those communities, as well as train residents to become family physicians.
We're going to talk about the residency a little bit later on in the program. It's a really interesting program, one that I love to brag about to whoever wants to hear me. Let's talk about the purpose of community health centers in general.
Sure. So community health centers actually started in Boston. They originally started in South Africa, and the model was seen as being very conducive to promoting health in the communities in South Africa. So that model was transplanted to Boston, Massachusetts at Columbia Point. It's now grown to 8,000 community health centers nationwide, serving 20 million people. And the primary purpose of community health centers is to provide comprehensive primary care services as well as other services to the communities that it serves.
Now, one of the questions that I get often is, who can go to a community health center?
So really anyone can go. There's somewhat of a myth that you have to be a certain income level to go to a community health center, and we actually serve people of all socioeconomic levels. We're really geared to serve the entire community. Predominantly, the community health center movement started in communities where there were no physicians. Physicians generally tend to maldistribute. They don't go to all the areas where patients are and where they're needed. So community health centers serve that role of providing services to people who otherwise would not get care. But we're set up to provide comprehensive quality services to virtually everyone.
Has community health centers seen a bit of a resurgence as a result of the economy that we're in at this point?
Yes. The reason why community health centers are quite popular and are becoming more discussed in the national media and in the state media is the fact that there's some real issues with cost, and there's real issues with quality of health care. There are real issues with coordination of care, and the community health center model actually addresses all those issues. There have been many studies that show that the care that's provided in a community health center actually is superior to other places. And very importantly to the public right now, with the cost of health care hurting small businesses and really hurting the economy, and virtually everyone's affected by this, the community health center model has been shown in multiple studies to provide better results at lower costs. So it's people are very interested in the model right now.
One of the statistics that's up on our screen, GLFHC is one of the top 10 employers in the city of Lawrence. Yes.
And frequently, these are communities that may struggle with high unemployment rates. These are very good jobs. There are skills attached to these jobs, so we do very significant training of employees. Besides the level of physicians and nurses and registered nurses and medical assistants, there's a whole host of other employment opportunities that a community health center provides to a community. So there have been a lot of studies that actually show the economic impact of a community health center on a community, and it's quite significant.
One of the things that I marvel in when I think about the health center is the humble beginnings we had to today,
yes,
where we offer an amazing array of services, from mammography services, pharmacy services. Let's talk about some of those programs.
Sure. So I wasn't here in 1980, but when the health center started, my understanding is it was in a funeral home in Lawrence, and now we've grown to 4 primary care sites, quite large sites, serving literally tens of thousands of patients every year. We have 2 other smaller sites distributed throughout the city of Lawrence, but we also are in the 2 schools, the 2 high schools in Lawrence. We are in the Lawrence High School, and we're in the Greater Lawrence Vocational Technical School, so we provide on-site services to high school students. This is a patient population that generally does not want to go to the doctor. Frequently, these are kids that wouldn't be acquiring healthcare services if we didn't come to them. And there's a general theme at Greater Lawrence that we don't just wait for patients to come to us, to the office or to the hospital, but we actually go out to the community. We have a really nationally known program for homeless patients that we're very proud of, and our residents participate with our attending physicians in that program. We have very strong diabetes programs, asthma programs. We have a very incredible pharmacy program. And a lot of people think, well, what's the big deal about a pharmacy program? But it's been shown that one of the major reasons why people end up back in the hospital is because of not getting their medications or taking their medications when they should. And there's a lot of barriers to people to get their medications. So having those services on site is really tremendously important. It helps us coordinate care. Our physicians know what our patients are actually getting when they get it, and it really has improved the quality of care. We also have, as you mentioned, the cancer screening services for breast cancer with our mammography unit. We have many different physicians that provide specialty services as well, such as high-risk obstetrics care for women that have higher risk pregnancies. That's one of the things that we're quite proud of if you look at the infant mortality rate and look at other parameters that show the quality of care of babies in Lawrence, it's improved dramatically through the growth of the health center.
And speaking of the high-risk program, the high-risk OB program, we just recently expanded to a new clinical site over at Lawrence General Hospital.
Yes.
Part of that is the high-risk OB program, but also it's part of something called emergency diversion. Can you touch upon that for a second?
So that's a program that we're just developing now, but there are 2 actually major things that we're looking at. One is that a lot of people are still going to the emergency department not knowing that we're open extended hours till 9 p.m. most evenings. Some people just don't know that they can call us to get questions answered, but also patients that are not our patients end up in the emergency department. And I think everyone knows the difficulties with going in the emergency department, both in terms of time, the convenience. People can be there, quite a long time. The cost is just tremendous. And if you look at what ends up in the emergency department, the majority of patients in emergency departments aren't emergencies. So it's a very high cost aspect of care that we're all paying for. So one of the things that we're working on with emergency diversion with Lawrence General Hospital is an ability to take some of those patients that are really not emergencies but may have acute issues and see them promptly right in the hospital. The other program that we're very excited about is there's a lot of discussion about when people leave the hospital and then get readmitted to the hospital, and there are a lot of reasons why that is. So one of the other things we're looking at for use of that clinic is to really tighten up and improve the post-hospitalization care that people get by facilitating the coordination of the care by having a site right in the hospital.
And is this a new program that's being introduced? I mean, not necessarily for the health center, but nationwide as an effort of cost savings?
There's a tremendously increased awareness about where we're spending our healthcare dollar. And one of the major reasons why we're spending so much money is on hospital care that is preventable. So primary care really is the answer to both keeping people out of the hospital, and then if they end up in the hospital, to make sure that they don't end up going right back in. So that's where we have a whole program. We have a whole staff that actually looks at making sure that people's needs are getting met after hospital discharge.
And we're coming up on the break. One of the things that we're going to actually address in the second segment is healthcare reform, and emergency diversion is all part of healthcare reform. And I think we're going to try to clear up some of the misconceptions and misunderstandings of the term healthcare reform coming up in our next segment. Our guest for this episode of Pulse Television is Dr. Joseph Gravel, Chief Medical Officer. We'll be back in a few minutes right here on Pulse Television.